In this video, Dr. Furze will share with you details about sinus surgery, what it is, the benefits, and how to prepare.
Hi, I'm Dr. Furze, and I'd like to help you understand sinus surgery. My goal when performing sinus surgery is to improve your nasal and sinus function. This will give you the ability to breathe better, have fewer sinus infections, less facial pressure and/or fewer pain symptoms associated with blocked sinuses. I firmly believe that each of my patients deserve to be able to breathe freely and improve their lives by reducing sinus issues. I perform minimally invasive and functional endoscopic sinus procedures designed to open the sinus drainage pathways so that your sinuses can function normally. Ways sinus surgery can improve your health: improves nasal breathing, provides long-term relief from recurring sinus infections, reduces sinus or facial pressure, eliminates or improves postnasal drip, runny nose, sinus pain and pressure, dry mouth, nasal bleeding, breathing issues during sleep, chronic cough due to sinus drainage, and even migraine headaches triggered by sinus pressure. Types of sinus surgery: minimally invasive balloon sinuplasty. Minimally invasive balloon sinuplasty is performed in our office using local anesthesia and gentle oral sedation. It is similar to having a dental procedure. This procedure involves using a camera to identify the sinus openings in the nose and then gently threading a balloon into the sinus openings and dilating them open. The balloon is then removed and the sinuses can drain and be flushed if necessary. Most people have up to 6 sinuses that can be treated in this manner. The procedure can take anywhere from 30 minutes to 2 hours depending on your specific condition. Advantages of minimally invasive balloon sinuplasty: faster and more affordable than traditional sinus surgery. Approved by all major insurance carriers and Medicare. Recovery time of just 1 day compared to 2 weeks or more with traditional sinus surgery. No need for general anesthesia. Performed in our comfortable office setting. Highly effective. Minimal to no bleeding. Extremely low risk of complication. Traditional functional endoscopic sinus surgery is performed in the operating room with the use of general anesthesia. You will be fully asleep for this procedure. This surgery involves using a camera to visualize the sinuses in the nose, and then we use instrumentation to remove bone, polyps, and inflamed soft tissue from the multiple sinus sites. This surgery typically takes at least 2 hours and will involve more invasive techniques than balloon sinuplasty. This will lead to an increase in bleeding, pain, and recovery. Advantages of traditional functional endoscopic sinus surgery: more comprehensive than balloon sinuplasty. Can treat some sinuses that cannot be treated with balloon sinuplasty. Ideal option if you have very significant sinus issues. Best option if balloon sinuplasty has been performed without delivering relief of the sinus issues. Sinus surgery process: what to expect. Prior to surgery, we will meet with you 4 times. Your first visit will be a telemedicine appointment where we will get to know each other. We will discuss your functional sinus issues, any aesthetic concerns, and your medical and surgical history. You will visit our office for your second appointment. We will take a CT scan of your face, nose, and sinuses using our in-house CT scanner. This will allow us to diagnose any nasal obstructions or any sinus or facial abnormalities. If you have external deformities or decide to undergo cosmetic nasal or facial surgery at the same time as your sinus surgery, high-definition photographs will also be taken at this visit. Your third appointment will be held via telemedicine so that we can show you your CT images and demonstrate any abnormalities that require correction. If photos were taken at your second visit, we will review your computer-generated images of your projected surgical outcome. We will also walk you through your potential surgery. If surgery is recommended, you may be eligible for minimally invasive sinus surgery, which is performed with you awake in the office like a dental procedure. In the event that you may need more comprehensive sinus surgery, it will require full anesthesia in the operating room. Your surgical plan will be reviewed with you at this visit and a preoperative appointment will be scheduled. If you are scheduled for minimally invasive balloon sinuplasty, you will be scheduled for the procedure and can report to the office on your procedure date. If you are scheduled for surgery in the operating room, you will undergo a preoperative visit. I will perform a final nasal evaluation to confirm the CT findings and the surgical plan. We will also order prescriptions for postoperative pain medications and any needed antibiotics. Your tests need to typically be completed 30 days before surgery. 2 weeks prior to surgery, stop taking ibuprofen or any aspirin-based medications in order to avoid unnecessary bleeding and complications. Only take supplements that I have previously approved. If you're on blood thinners, we may have to communicate with your primary doctor for a plan to discontinue them. Begin sleeping face up a week or 2 before your procedure. You cannot drive after receiving anesthesia. Wear clothing that is easy to take on and off, such as a button-up shirt, so that you do not have to slip anything over your nose or face. Report to the office 15 to 20 minutes before your scheduled procedure. We will bring you into the treatment suite and talk you through the entire procedure. We will begin with topical medication to make your nose numb and decongested. We will then offer a gentle sedative and some dental-type injections for further comfort. Once these medications are working, we will use a camera inserted into the nose to identify the sinuses and gently insert a medical-grade balloon. It is common to feel some discomfort and pressure as the balloon is being inflated. We typically will keep the balloon inflated for 2 minutes before it's removed in order to receive the best results. The dilation may be repeated for all 6 major sinuses. Once the dilations are complete, the nose will be cleaned and you will be able to walk out of the office with just a gauze bandage. Your sinus surgery will be performed under general anesthesia at an accredited surgical facility in Orange County. Typically, sinus surgeries are performed in 2 to 3 hours, although it could be longer to handle any functional breathing issues inside your nose. Since the procedure is done on an outpatient basis, you will return home afterward, but you need someone to transport you home. On the day of surgery, you will check into your assigned surgery center. At that time, you may be required to pay any copays or coinsurance if there is an insurance component, and a cosmetic charge for any aesthetic portions of the surgery. Health insurance often covers most of the costs of sinus surgery, but most patients have a deductible or coinsurance. The nurse will review your medical history, such as any medication allergies, and will start your IV. I will visit you before surgery and answer any last-minute questions you may have. Our anesthesiologist will speak with you and begin the anesthetic process by giving you some pre-operative medication. Your anesthesiologist will also escort you to the operating room and then to the recovery area when your surgery is finished. During your recovery time, your nurse will make sure you are doing well, remove your IV, and help you get dressed. Since sinus surgery is done on an outpatient basis, you will return home after recovery. You will not be able to drive yourself home after surgery. We will call your driver with an estimated pickup time on your behalf. Every sinus patient is different, and every person heals in their own way and at their own pace. The recovery time depends on several factors, including the surgical techniques used and the degree of sinus abnormalities prior to surgery. Recovery from in-office balloon sinuplasty procedure. The majority of recovery occurs in 24 hours. Take the day of the procedure to rest. It is common to have a headache after the procedure. Take Tylenol as needed, or if there is minimal to no bleeding, you can take ibuprofen. Physical activity can resume the next day unless there is still some residual bleeding or if you are informed otherwise. Start slow and work your way up to full physical activity over the course of a few days. You can resume a normal diet as soon as you like. You can fly immediately following the procedure if needed. What not to do after sinus surgery. I'm Dr. Furze, and I'd like to thank you for your interest in our practice. If you have any nasal, sinus, rhinoplasty, or other facial plastic surgery concerns, give us a call today so that we can help you breathe better, look better, and live better.